Hello, my name is Marion Winkler, and I'm very happy to be here today to talk with you about quality of life. Have you ever been asked by your doctor or healthcare team, how is your quality of life? When I was preparing for a conversation with a home nutrition support advocate recently, I asked that question. And surprisingly, the person responded, "No one's ever asked me that before. Let me think about that for a while." As clinicians, we are very aware of the time-consuming nature of home parenteral and enteral nutrition-related procedures, but I often wonder if we really understand what impact these therapies have on someone's lifestyle and family and personal relationships. Now, many of you know that I've been researching quality of life for most of my career. When I began reading about what others had published, and this is going all the way back to the 1980s, I found a body of work for TPN that found worse quality of life in home parenteral nutrition patients compared to healthy people or other patients who had intestinal diseases but did not require home TPN. And this worse quality of life was largely explained by decreased physical function, and it acknowledged that depression, pain medication dependency, sleep disturbances, frequent urination, fear of therapy-related complications, and the burdensome equipment and infusion schedule all influence quality of life. For home enteral nutrition consumers, not being able to eat food, decreased sensory pleasure, body image issues related to having a feeding tube or having problems in the mouth with the ability to chew and swallow, sleep interruptions, inflexible schedules like having to fit your lifestyle around the feedings, travel challenges, altered family dynamics, social isolation, strained social relationships, and reduced self-esteem were frequently cited by researchers as having an association with poor quality of life. On the other hand, I was actually hearing from my patients and consumers like you who were attending Oley Foundation meetings that their quality of life was actually good and that they knew their nutritional therapy was keeping them alive, giving them the strength to do the activities they really wanted to be able to do. Another interesting fact I learned from studying quality of life was that physicians, clinicians, parents, and others often rate their patient or their child or their family member's quality of life much lower than the person or child rates their own quality of life when asked. I see this actually all the time in our clinic. We use a brief questionnaire to evaluate quality of life in our office and home nutrition program, and we're very surprised knowing what we know about the patient's lifestyle, their health and wellness, their disease state, and their feelings about having to do nutrition therapy every day, that they still rate their quality of life as good or very good. And it's less common in my experience to see someone rate their quality of life fair or poor. Yet that's sometimes what we expect we're going to hear. And it's often what we find in research studies that measure quality of life using generic health-related quality of life questionnaires. Now, quality of life among caregivers is also very important, and recently there's been a number of publications addressing this topic. And the topic explores caregivers of adults as well as parents of children caring for their children. Generally speaking, the research reports caring for someone with medical complex management, including home enteral or parenteral nutrition, is overwhelming, a significant burden, requiring a huge time commitment, affecting all aspects of family life, creating financial distress, and resulting in emotionally taxing feelings and exhaustion. The need for professional support for caregivers and for self-care is extremely important, without which caregivers and patients express that they feel like they're going to sink or swim if they're thrown into the deep end. Acquiring skills, competence, and confidence in the caregiving or self-care role helps to appreciate the benefits and focus more on positive experiences. Interestingly, a finding in a recent small study of parents of children with short bowel syndrome by Newman and colleagues reported that half of parents perceive their child's journey to have pushed them towards personal growth. And more than 2/3 of those parents perceive their child's quality of life to be higher than what they were told to expect at the time of diagnosis. So some of the reasons I decided to research quality of life was to better understand how consumers like you define quality of life and what factors influence your quality of life. Knowing this, as well as understanding what your goals and expectations are, is so important to establishing a good relationship with your doctor, your dietitian, your clinician, your home care or health care team. The question becomes, how best do you and we communicate and discuss quality of life and your goals and expectations? Healthcare agencies in the United States and really around the world have now developed tools and training to help healthcare professionals better engage patients and families in their decision making. The SHARE approach from the Agency for Healthcare Research and Quality recommends 5 steps to engage in meaningful dialogue about what matters most to the patient. So they suggest as clinicians that we seek our patients' participation, help our patients explore and compare treatment options, assess our patients' values and preferences, reach a decision together with our patient, and evaluate our patient's decisions. When a clinician understands your personal experience, he or she is able to address what matters most to you. When you tell your story and are really listened to, communication happens at a whole different level. When we as clinicians really understand your life experiences, your goals, your expectations, we can have a meaningful conversation about quality of life. So let's think about quality of life and how you would define your own quality of life. If we look in the dictionary or conduct a Google search or look in the published nutrition research, we'll find a number of definitions, including this one from the World Health Organization. And I really want to know and have you think about whether any of these quality of life definitions resonate with you. So the WHO describes quality of life as an individual's perception of life in the context of their own culture and value system, and in relationship to their goals, expectations, and concerns. It's a state of complete physical, mental, and social well-being, and not merely the absence of disease. And clearly, there's a subjective component of satisfaction and happiness in life. And in the dictionary, regardless of which one you look at, all of the definitions address well-being, enjoyment of life, and to the degree of which someone is able to enjoy activities of daily living. In the published literature in the nutrition support field, a number of definitions of quality of life have been offered. One is having no major physical complaints or psychological symptoms, no substantial restriction of social and leisure activities, overall satisfaction with conditions of life, and an understanding of the need for therapy. Frequently, it addresses satisfaction with both health and physical function, performance status, socioeconomic status, psychological and spiritual life, and family life and support systems. And when we look at the attributes influencing quality of life, the positive ones tend to be having no pain, feeling healthy, making others happy, feeling happy yourself, ourself, and being able to socialize and travel. Now, the general theme clearly among all these definitions are satisfaction, well-being, and enjoyment of life. What also is important for understanding quality of life is to know what factors actually influence quality of life both positively and even negatively. And if we know this, we can help our patients overcome the negative attributes. We can develop strategies or address them so that we can move towards all of the positive ones. So some of the factors from my research in interviewing adults who use home TPN, I found that optimal quality of life was expressed as being able to do what I want to do when I want to do it. And the things people wanted to be able to do included working, household chores, attending community, church and social events, playing sports, eating and dining in restaurants, and in fact, being able to eat what I want to eat when I want to eat it was really an important quality of life issue. Some of the positive factors associated with good quality of life were having good health, being happy, having strength and stamina, having strong faith, good family support, and financial security. And the negative ones, which again, we can, if we know, we can help to address them, are being in constant pain, feeling fatigued, having little or no strength or stamina, having ostomy leakage, or having disabling and disastrous diarrhea. Now, more recently, research has told us that the infusion schedule, both the number of days or nights per week and the number of hours it takes to give the feedings, greatly influences quality of life. Quality of life, not surprisingly, is better with time off nutrition therapy. Surprisingly, I'm finding that many consumers do not even know that there's possibility of having less nights, shorter infusion times, or even flexible feeding schedules. And what this means to me is that we as clinicians need to do a better job of discussing goals and expectations of therapy. Now, I need to say very clearly that less days or nights, shorter infusion times, and flexible feeding schedules for both TPN and tube feeding are not always appropriate for everyone. There are many considerations that we as clinicians take into consideration in establishing the number of infusion days and nights, or the length of infusion time, or the schedule for the feedings. But this is a topic that certainly can be addressed with your healthcare team. And any discussion you can have around the topic of putting your nutrition therapy into your lifestyle rather than having to fit your lifestyle around the nutrition schedule is definitely a quality of life issue. Consumers of home TPN and home enteral nutrition are resilient. And in my research, people talked about needing TPN as being hooked up, tied down, but happy to be alive. Recognizing that the benefits of home nutrition therapy outweigh the burdens of having a central line or using an infusion pump. And in research conducted by Dr. Cheryl Thompson, home tube feeding consumers described enteral nutrition as a blessing, weighing the amount of life lived rather than the amount of time lost doing the feedings. So, how should you start a conversation about quality of life, or more specifically, about what is happening in your life with your doctor or healthcare team? First and foremost, always prepare for your visit. Second, write down the main points or questions that you want to address in order of your greatest concern. Sometimes a checklist is helpful. Third, tell your doctor or clinician in the very beginning of your appointment that you have specific questions and topics to discuss so that time is saved for you during the visit. Fourth, during your visit, speak up. Make sure that you get the chance to ask those questions. Make sure you understand what is being said. Ask for clarification. Restate what you heard to confirm that you understand the information correctly. Be an empowered consumer. Your healthcare team can provide the best care if they fully understand what is important to you and where you are coming from. Knowledge is important. Knowledge is empowering. Find resources. Many are available through Oley and on the website. Realize that you are not alone. There are many other people who share similar experiences to you, who you can learn from or who you can help. Build a broad network. Seek and be willing to ask for help. Join a support group. Expand your coping strategies. Keep a journal to record good days and accomplishments. This can be uplifting, especially on bad days. Keep a list of enjoyable activities that lift up your spirits. Turn problems into challenges and find creative solutions. Resolve negative emotions through breathing, exercise, yoga, and mindfulness activities. Incorporate food into your life, even if you are not eating it. Plant a garden, cook, sit at the table with family and friends. Enjoy the ambience and atmosphere and social conversation. Celebrate successes. Give yourself a pat on the back. Take credit for your accomplishments. Laugh more and relax. Be alive, be well, and be even better.